nasopharyngeal swab is traditionally held as the standard of care when it comes to swabbing patients. The way it's done is a swab is inserted into the nasopharyngeal passageway and actually hits the nasopharyngeal wall in the back. And it sounds like it's very invasive because it is. It's also very uncomfortable. Patients can sneeze afterwards, they can tear afterwards, and they'll have some residual discomfort after the swab. However, the swab is not supposed to hurt. It might tickle, it might feel a little discomfort, but you are not supposed to cause the patient any pain. On the left, it is a demonstration of what the swab should look like when it is in the patient's nostril. Contrary to what most people think, the swab is not advanced upwards. It is actually advanced straight back below the inferior turbinate all the way to the posterior wall of the nasopharynx. Remind your patients that they might have to sneeze, or that their eyes may water, or they might feel some pressure in different parts of their face, but it's all normal. Make sure you give them tissues before you perform the swab and ask them to sneeze away from you if they have to. Now, I'm going to circle the nasopharyngeal wall, which is right over here on the left. Yes, it's actually supposed to go that deep. However, as I've stated before, it's not supposed to cause them any pain. On the right side, I'm going to circle the inferior turbinate. That is where your swab is actually supposed to be under. So again, the swab is advanced straight back, but not upwards. This is a step-by-step on how to perform this swab. So make sure you educate the patient about the procedure and the discomforts. What I like to do is I peel the swab open a little bit and I measure the depth that I need to go from the earlobe to the nostril while the swab is still in its wrapper. And then I use my swabbing hand to grab the depth that it's measured at. Then I can remove the swab from its wrapper and instruct the patient to lean their head back 70 degrees. When I remove the swab from the package, make sure you don't touch anything or touch the patient's face or anything like that. You want to really minimize the contamination. So you have your depth. You've asked them to lean their head back 70 degrees. You're going to insert the swab with a twisting motion. It's going to be parallel to the jawline, or you could think of aiming towards the patient's tragus or their earlobe, and you're going to advance it in. It should be steady, it should be smooth, and it should not hit any resistance. If there is resistance, you're going to have to readjust your angle. Insert the swab to the proper depth, twist a few times, and remove it with a steady motion. Tell the patient that the procedure is complete, and place the swab in the medium. Snap it if it's one of the types that has a little notch in it. Secure it and make sure you label it correctly while confirming the patient date of birth and name. Remember, you always want to use two patient identifiers to make sure that there are no errors. Some special considerations and contraindications. If your patient has a deviated septum, you can use the other nostril. If you can't get it to go in, you can use a different swab such as the mid-turbinate or oropharyngeal swab. However, you should not have any issues. Think about athletes like soccer players, basketball players. Oftentimes they get hit in the face, whether they get into an accident on the field or they get hit in the face with a ball. These active young people often have deviated septums. So it's really important to know your demographic and ask questions in people who would have a higher chance of having a deviated septum or have a higher chance of having nose issues. So just be careful when they say that they have had some issues with their sinuses. It probably is not going to keep you from doing the swab, but they might be pretty sensitive. So just take that into account. Some contraindications to the nasopharyngeal swab are any recent nasal, orbital, or head trauma. And I'm talking major head trauma that had them hospitalized, that had them to have major surgery. Now, you're probably not going to swab these people, but if you ever have to, make sure that this injury that they've had is not recent and that it's something that they've fully recovered from. If they have a nosebleed, don't swab them. And if they have any recent surgery, such as any plastic surgery or something like that, then you definitely want to avoid this swab. So that concludes this portion on the nasopharyngeal swab. Please join me for the portion on the oropharyngeal.